It began in February of this year when I was taking care of my father, who was being treated for lymphoma at another hospital in Birmingham. And as I entered the parking lot to go and see him that day, I had a bit of a focal seizure, a visual seizure, and managed to get to his room and visit with him, but had a friend come and take me to Brookwood, where I underwent a CT scan in the emergency room, and later that day was diagnosed with 4 brain tumors. And it began a fury of activity. I was admitted to the hospital that day and found out that the primary tumor was in my lung, was the non-smoking type of cancer at stage 4 with metastasis to my brain. I was in the hospital for 3 days with numerous tests, and the outlook was pretty grim. I will never forget, in the fury of doctors and nurses and tests and people, Dr. Ashraf and his brown eyes. And I knew when I saw him that he didn't just care about treating me, he cared about me. He told me that the outlook was grim, but that we would do genetic testing that wouldn't be done in every other hospital, potentially, but that he would do everything he could, and I believed him. I just knew that somehow I was in the right hands, that someone was listening to my questions, that they were giving me the appropriate information as much as I could take in at the moment. It was a barrage of information, but he was honest, and he didn't give me false hope. He gave me real hope. His compassion and his ability to present the possibilities were what gave me faith in him. The idea that there was new treatment out there, that there was potential for something different than the textbook case was what really gave me confidence that I was in the right place. As the sort of fury and turmoil of it all settled down and we began to go step by step, it was wonderful to see him walk in that room with the tiniest bit of good news. Those were the things he presented as if they were huge, because they were to me. The new treatments, and he has said to me before, you know, I've asked him questions and I want to know numbers and the data, and he will say, I don't have any other cases like yours. You know, you're paving the way. This is a new treatment. And we just celebrate at every office visit. 9 months later, the lung tumor my chest x-rays are red as normal. It's not there anymore. And after radiation on my brain, the brain tumors are smaller or stable. So I am extremely grateful for the kindness and the honesty that he has given me and that whole group has given me. It's really kind of amazing, because not only do they treat you personally, but they listen to you personally. Dr. Ashraf knows my children by name. He knows where every one of them are in school. He knows if they're not there with me at an appointment, he wants to know what they're doing. They don't really talk about the cancer. They ask me how I am. He wants to know, how am I doing? What am I doing? What makes me feel better? What makes me feel worse? The cancer is almost something as an aside. He is my doctor. He cares about me. Well, when it comes to my children, that's when I will get emotional, but because my diagnosis was so traumatic and so sudden, all three of my children put their educations on hold to come home and be with me. And as I said, Dr. Ashraf knew them all by name. He knew where they were in school and what they were doing. And he treated them all, down to the 21-year-old, with the ultimate respect. He answered every question. He held their hand. He took the time to describe to them things that were happening that they didn't understand. His nurses would take them outside the room and explain what was happening to their mother. So once again, I can't say enough about the care I received there.